have you ever wondered how crucial your liver is to your overall health? Picture this, a bustling city, cars whizzing down the streets, people coming and going, everything functioning in a synchronized rhythm. That's your liver. It's the bustling city within your body, performing over 500 different functions to keep you in tip-top shape. Your liver, a superstar, a jack of all trades. It's a detoxifier, cleansing your blood of harmful substances like alcohol and drugs. It's a metabolic powerhouse, converting the food you eat into energy and storing it for later use. It's a storehouse, hoarding essential vitamins and minerals your body needs to function properly. But what when this city, this liver, starts to falter? Imagine the chaos. Traffic jams, power outages, dwindling resources. In your body, this could translate to fatigue, jaundice, abdominal pain, and even more severe health complications like liver disease or cancer. Your liver is a silent hero working behind the scenes to keep you healthy. It doesn't ask for much, but it does need your care. A healthy liver is key to a healthy body. It's essential to keep it running smoothly, just like the bustling city we imagined earlier. Now, don't want to scare you, but it's important to note that there are certain things that can harm your liver. Some are obvious, like excessive alcohol or unhealthy diet, but some are not so obvious, like certain medications. Yes, you heard that right. Some medications, even those that are meant to help us, can potentially harm our liver. Understanding the importance of liver health, let's delve into some medications that can potentially harm this vital organ. In the scenes to follow, we'll explore these medications and how you can keep your liver, your body's bustling city, running smoothly. Because when it comes to your health, knowledge is power. Let's empower ourselves to make healthier choices for our livers and for our lives. The first medication that can harm your liver is acetaminophen. Acetaminophen is a household name, often utilized to soothe headaches, reduce fevers, and relieve minor aches and pains. Despite its common use, it carries a little-known risk: potential liver damage. When taken in high doses, acetaminophen can cause the liver to work overtime, leading to its damage. This damage can range from minor changes in liver function to complete liver failure, a life-threatening condition. Signs of liver damage from acetaminophen can be subtle at first. You might feel tired, lose your appetite, or experience stomach pain. As the damage progresses, these symptoms can evolve into more serious conditions, such as jaundice, a condition where your skin and eyes turn yellow. Remember, it's not about completely avoiding acetaminophen, but rather about using it responsibly. Acetaminophen, a common over-the-counter drug, can be harmful to your liver if misused. Next on our list is amoxicillin clavulanate. Often prescribed to combat bacterial infections, this common antibiotic is a go-to for many physicians. It's found in your medicine cabinet and possibly even in your system right now. But did you know that it can potentially harm your liver? Yes, while amoxicillin clavulanate is busy fighting off bacteria, it can also wage an unintended war on your liver. Over time, this war can lead to liver damage. So, what are the telltale signs? Well, if your skin or eyes start to take on a yellowish hue, that's a sign of jaundice, which can indicate liver trouble. Feeling unusually fatigued or experiencing a loss of appetite could also be red flags. And if your urine darkens or your stool becomes pale, that's another sign that your liver may be under stress. Always remember, every medication has its risks and benefits. This common antibiotic can pose a risk to your liver health. Another medication that can potentially harm your liver is isoniazid. This medication is commonly used to treat tuberculosis, a serious bacterial infection that primarily affects the lungs. However, isoniazid has a dark side. It can potentially cause liver damage, especially when used over a long period of time. The damage can range from mild liver inflammation to severe hepatitis and even liver failure in rare cases. This is why it's crucial to be aware of the signs of liver damage. So, what should you watch out for? Look out for symptoms such as fatigue, loss of appetite, nausea, dark urine, and jaundice, which is a yellowing of the skin and eyes. These might be signs that your liver isn't very happy with the medication. It's also important to remember that liver damage from isoniazid isn't guaranteed. It's just a possibility that requires awareness and caution. Used to treat tuberculosis, isoniazid demands careful use and monitoring to safeguard your liver. Fourth on our list is methotrexate. Now, this medication is commonly used in the treatment of certain types of cancer and autoimmune diseases, like rheumatoid arthritis. It works by slowing down your body's immune system, which can be incredibly beneficial for those battling these conditions. However, the downside is that methotrexate can be rather harsh on the liver. It can lead to a condition called fibrosis, where the liver becomes scarred and struggles to function properly. In more severe cases, it can even cause cirrhosis, a stage where the liver damage is irreversible. So how do you know if your liver is taking a hit? Watch out for signs like fatigue, loss of appetite, nausea, and yellowing of your skin or eyes. These could be early signs of liver damage. It's crucial to communicate any such symptoms to your healthcare provider promptly. Methotrexate, a medication used to treat cancer and autoimmune diseases, can be taxing on your liver. Next, we have a cholesterol-lowering medication called statins. These are commonly used by individuals who are looking to control their cholesterol levels and lower their risk of heart disease. However, while they are handy in managing cholesterol, statins do come with a downside. They have the potential to cause harm to your liver. Statins work by slowing down the production of cholesterol in your body, but this process can occasionally lead to an increase in liver enzymes. If these enzymes reach a high enough level, it can lead to inflammation and damage to liver cells. So, what should you look out for? Signs of liver damage can include fatigue, loss of appetite, and jaundice, which is a yellowing of the skin and eyes. If you're experiencing these symptoms while on statins, it's important to consult with your healthcare provider. While helping lower cholesterol, statins can potentially harm your liver. The sixth medication on our list is azathioprine. Azathioprine is a powerful drug most commonly used to prevent organ rejection in transplant patients. It's also used to treat certain autoimmune conditions. But, like many strong medications, it comes with its share of risks. One of the major potential side effects of azathioprine is liver damage. This can occur because the drug can cause inflammation and scarring in the liver over time. Now, you might be thinking, how would I know if my liver is being affected? Well, symptoms of liver damage can include feeling tired or weak, loss of appetite, and yellowing of the skin or eyes. If you're on azathioprine and start noticing these symptoms, it's crucial to reach out to your healthcare provider immediately. Remember, the goal is not to scare you, but to keep you informed. Azathioprine, used mainly in organ transplant cases, can cause liver damage. Next, we discuss a medication called tamoxifen. This drug is commonly used as a treatment for breast cancer. It works by blocking the effects of estrogen, a hormone that can fuel the growth of breast cancer cells. However, it's important to note that tamoxifen can potentially cause harmful effects on your liver. Over time, it may lead to a condition known as fatty liver disease, where fat builds up in the liver, interfering with its ability to function properly. So, how can you tell if tamoxifen has affected your liver? Signs to watch out for include fatigue, loss of appetite, and unexplained weight loss. You might also experience yellowing of the skin and eyes, a condition known as jaundice. If you notice these symptoms, it's crucial to consult with your healthcare provider immediately. Remember, while tamoxifen can be a life-saving treatment, it's important to monitor your liver health. Tamoxifen, a breast cancer treatment, can potentially damage your liver. The eighth medication on our list is valproic acid. Commonly used to manage seizures, bipolar disorder, and migraines, valproic acid is a vital medication for many individuals living with neurological disorders. However, like many medications, it carries potential risks. One of these risks is liver damage. Valproic acid can, in rare cases, cause an acute and sometimes fatal liver failure. This risk is more likely to occur within the first 6 months of treatment. It's essential to be aware of the signs of liver damage, which may include fatigue, loss of appetite, or a yellowing of the skin or eyes. If you experience these symptoms while on valproic acid, seek medical attention immediately. Remember, your health should always be your top priority, It's crucial to balance the benefits of medication with their potential side effects and to be informed about your treatment. Valproic acid, a medication for neurological disorders, can impact your liver health. Next up is a medication called rifampin. This is a medication often prescribed for treating tuberculosis, a serious lung disease. Like many medications, rifampin does its job well when it comes to fighting off the bacteria that cause tuberculosis. However, as it goes about its work, it can also cause some unintended harm, particularly to your liver. So, how does rifampin harm the liver? Well, it can lead to a condition known as drug-induced hepatitis. This is a form of liver inflammation that occurs when your liver has to work overtime to break down the medication. Over time, this can lead to liver damage. What are the signs to watch out for? They may include feelings of fatigue, loss of appetite, nausea, and a yellowing of the skin or eyes, also known as jaundice. If you notice these symptoms while taking rifampin, it's important to reach out to your healthcare provider right away. Rifampin, a tuberculosis treatment, can be harmful to your liver. The last medication on our list is methyldopa. Often used to manage high blood pressure, methyldopa might not be a name you hear every day, but it's certainly one that could have an impact on your liver's health. This medication works diligently to keep your blood pressure levels in check. Yet, like a double-edged sword, it can also cause damage to your liver over time. This is because methyldopa can lead to an increase in liver enzymes, which, if left unchecked, could result in liver inflammation or even more severe conditions such as liver disease. Now, how do you know if your liver is waving a red flag? Look out for symptoms such as nausea, loss of appetite, or a yellowing of the skin and eyes, also known as jaundice. These signs could indicate that your liver is under strain and needs attention. Methyldopa, a high blood pressure medication, demands careful use to prevent liver damage. It's all about balance, being aware of your body, and taking action when necessary. After discussing these 10 medications, it's clear how important it is to monitor our liver health. Let's take a moment to revisit the main points. We started with a deep dive into the first medication and its potential harm to the liver. It's crucial to remember that while this medication may be beneficial for some, it might not be suitable for everyone, especially those with existing liver conditions. Next, we examined the second and third medications, both of which can cause significant liver damage if not appropriately managed. We highlighted the need to follow the prescribed dosage and not to exceed it, as this can lead to serious complications. The fourth and fifth medications on our list also pose a risk. These substances may cause harm to your liver over time, even if you don't feel any immediate effects. It's a silent battle that your liver fights every day, and it's one that we need to be aware of. Moving on to the sixth and seventh medications, we discussed how prolonged usage could lead to liver damage. Again, it's paramount to consult with a healthcare professional before starting or discontinuing any medication. The 8th, 9th, and 10th medications were our final subjects. These medications can be particularly harmful, leading to severe liver diseases if not taken under strict medical supervision. Throughout our discussion, we've also touched on the signs of liver damage. These include fatigue, yellowing of the skin and eyes, and abdominal pain, to name a few. If you notice any of these symptoms, it's essential to seek medical advice immediately. In conclusion, while medications can offer relief and treatment for various conditions, it's crucial to remember that they may also pose risks to our liver health. Always consult with a healthcare professional before starting or stopping any medication. This is not just about protecting our livers, it's about taking an active role in our overall health. Remember, your liver plays a vital role in your health. Protect it, and it will protect you.